Hi, I'm Dr. Leena Jain, Plastic and Reconstructive Surgeon, and you are at Plasticos Clinic. Today we'll talk about how do you treat breast asymmetry. Now, in all of us women, the breasts are never symmetric. There is about 10% difference in the right and the left breast, but the difference is too small to be actually noticeable. However, in some patients, the difference can be quite a bit and significant that it comes to their notice and it is a source of embarrassment, or it is a source of lowering their confidence because they are not comfortable when they look at themselves in the mirror. Of course, the asymmetry can be camouflaged by your clothes by using padded bras or using inserts, but without clothes, it's quite obvious, especially in things like a swimsuit. So, how does one correct breast asymmetry? Now, breast asymmetry needs a surgical treatment. There are no non-surgical methods to treat any kind of breast issue, whether breast enlargement, breast reduction, or breast asymmetry. Once a woman presents with breast asymmetry, we ask the patient what she wants or which size she is comfortable with. Is she comfortable with a smaller one or is she comfortable with a bigger one? And accordingly, we plan the treatment. If there is a gross difference, I'm sure there is, that's why the patient has come to us in the first case. So when the patient wants a smaller breast, then we do a unilateral reduction. That means we do a reduction on the bigger one. The reduction can be done by liposuction or by a formal excision of tissue. That will depend on the amount of asymmetry, the area where the asymmetry is predominantly located, and the age of the patient. When we do liposuction, we are not cutting any skin or any breast. We are removing the fat from usually the outer aspect, and then the loose skin kind of pulls back, retracts, and thus the breast comes to its position matching the opposite side. It may not be always possible to give a satisfactory treatment, and then one may need to consider a proper reduction surgery. Now, scenario B is when the patient wants a bigger breast, then we enlarge the smaller one either with fat grafting or putting a small unilateral implant. We plan the implant depending on the size of the bigger breast, and then if it's fat grafting also, we plan the volume of the fat to be injected depending on the opposite breast size. Now, the third problem is when there is a gross difference. That means one is very large and the other is actually underdeveloped or quite small. Then what do? Then we operate on both the breasts. On the very large breast, we make it a very small and reasonable size by doing a breast reduction. And on the one which is quite small, just fat grafting alone or just implant alone may not suffice because the skin may not be elastic and the skin also may be quite tight. Then we use tissue from the patient's back. It's called a flap, latissimus dorsi flap. We move the flap from front to back and we augment that breast with natural tissue. And along with that, if required, we can do a fat grafting, but then that's a secondary procedure. So to begin with, first thing, we do a breast reduction on one side. On the other side, we use patient's own tissue to augment the breast. The back from where we take the flap, we'll just have a straight line mark. We assess the result over 6 months, see how happy or satisfied the patient is and the surgeon, and then we can offer a second procedure wherein some amount of fat grafting may be required to give perfect results. So, a lot of options are there, and breast asymmetry is a condition which can be surgically corrected quite well. Thank you.